Hi, my name is Dr. Marta Vazquez-Ortiz and I'm a consultant in pediatric allergy at Imperial College London. I'm going to be talking about the BIO-FPIES research network that I'm co-leading in the FPIES Global Ally Day, and thanks so much for inviting me to share the work of our network. So these research networks started in 2017 as a collaboration between my institution, Imperial College, and the GENVIP group in Spain, led by Federico Martinón Torres. So this is a very strong group in the field of pediatric infectious diseases with focus on genetic studies to improve diagnosis. And we were very lucky to be able to set up this multi-center collaboration to apply advanced lab techniques that this group has applied in the field of pediatric infectious diseases, in this case, to food allergy, and in particular to acute FPIES. So we set up this multi-center study in 10 tertiary allergy centers from Spain and 2 from Italy, as you can see here. And we secured some funding, mainly from Spain, from a number of grants, and the FPIES Foundation very kindly did a donation at the beginning of our study, and we're very grateful for that. So the aim of BIO-FPIES is primarily to investigate the immune mechanisms underlying acute FPIES. So, you know, we don't know much about what happens in the body in acute FPIES reactions, and our aim is to really understand, you know, the immune mechanisms underpinning those reactions. And the aim is to identify potential diagnostic biomarkers and prognostic biomarkers. And for this, we're using these whole omics advanced techniques. So you might wonder how we're doing all of this. So we're recruiting patients, and mainly children, as you know, because FPIES, of course, usually presents in young children. So we're recruiting children with a diagnosis of acute FPIES with the aim to recruit them or collect samples when they undergo follow-up challenges to check if they have developed tolerance over time. And basically we collect samples up at baseline before starting the challenge, and then if patients react, we collect samples during their reaction, both in blood and in saliva, to try and see what's going on in the body. And that's sort of the lab side of things that Federico is leading on, and I'm coordinating on the clinical side of things. And our aim there is to define the clinical characteristics of our patient cohort in a broad sense, with a view to help improve current diagnosis and management of acute FPIES. And I will be presenting some of the first pieces of work we've published as a result of this. And last but not least, to understand patients' and families' needs to continue to co-design future strategies for clinical improvement and research in the coming years. And I will be presenting, you know, some little data on that as well. So this is part of the output of our clinical data. So this is about diagnostic criteria for acute FPIES. So you know there is no diagnostic test, there is no allergy test. You can do the test for FPIES. And diagnosis relies on healthcare professionals knowing about the disease and therefore being able to recognize reactions as such, and, you know, making the clinical diagnosis. And for this, there are a number of diagnostic criteria sets that have been published in the literature with some differences in between them. And basically what we did here with the first 100 patients that we recruited was to compare those different criteria sets. So we have to say all our patients made at least one diagnostic criteria set, and therefore the clinical suspicion of FPIES was very high. And we realized that 1 in 4, 25% of our patients did meet the most recent diagnostic criteria set, which is the one published in the 2017 consensus on FPIES. And that's probably because a significant proportion of our sample, our cohort, had mild presentations, and most of them have single food FPIES, and therefore, you know, that percentage of the patients didn't meet sufficient criteria to sort of kind of make the diagnosis. But this, in our view, as other authors have highlighted before, just reinforces how much FPIES is a heterogeneous disease with different types, you know, of different spectrum of severity in terms of the presentation and with significant geographical differences. And we need to understand much more, you know, the broad spectrum of presentation to make sure we have diagnostic criteria that's fit for purpose and, you know, don't overdiagnose, but also don't miss patients. And that's, as you know, very important because patients need to have the right label to avoid, you know, more reactions and delays and, you know, more impact on quality of life. So the second paper is about the results of the challenges, and particularly we saw that, you know, 1 in 8 children with a previous diagnosis of acute FPIES having a follow-up challenge, not reacting a challenge, will react the next time round when they were given the food at home after being, you know, negative and passing a challenge in hospital. And, you know, that's the first time that has been observed, and we thought it was very important to publish that, to highlight this possibility to families when they come to hospital to have challenge. And we're all very happy because it's negative, but we might need to warn about this possibility, at least for some foods like fish and egg, which are the predominant foods in our patients' cohorts. So we need to do more studies to understand why this is happening and whether there are some subclinical biomarkers within the first challenge that can tell us, you know, that this is, it looks like a negative challenge, but, you know, this child might be at risk of reacting next time round. So some work to do, but some interesting findings there. So this is the third piece of work I wanted to present. It's a poster from a congress, but, you know, we have analyzed now the sort of entire sample now with 180 patients with very similar results. So this is looking at the diet as a whole of the patients included in the study. So as I said, these are children with acute FPIES, and as you see here in Spain and Italy, it's generally to one food. So they, you know, each patient is a column and each row is a different food or a different food group. And in green is they tolerate, so they eat, nothing happens. In red is they have an acute FPIES reaction. And in yellow is they have an IgE-mediated food allergy. So basically, most of our patients have acute FPIES to one food or a food group, say fish or egg or milk, but they don't have any other FPIES reactions to any other food groups, and rarely they have other types of food allergies. So most kids tolerate everything else and they're fine just with FPIES or a single food. And that's relevant because there are some guidelines suggesting, you know, complex weaning advice and plans for kids with FPIES, which probably is very valid for kids with multiple food FPIES from the countries where, you know, those data come from, you know, to develop those guidelines. But we're showing here that this cannot be sort of broadly applied to say any cohort from any country, because there are lots of geographical differences. So in Spain, if you have FPIES, it's probably going to be single food, same in Italy, and probably your weaning plan as a baby can be, you know, as per normal for a healthy infant. So this is the last piece of work I wanted to share with you. And this is a nice survey we developed together with the FPIES Foundation and the medical advisory team, looking into what we're seeing as the key priorities by FPIES families. And we've done now a bigger survey, including some kind of open field comments that we are about to publish, but these are the preliminary results. So what's most important for FPIES families? The top 5 is more awareness among healthcare professionals and medical students to avoid misdiagnosis. That's the top priority. So lots to do for us healthcare professionals to increase awareness and train our colleagues, less specialized colleagues. Second, a predictive test to identify safe new foods to introduce in children's diet. Third, a predictive test to check for resolution of culprit foods over time. And fourth, a diagnostic test to identify FPIES acutely against common differentials, which is what we're working most on with the FPIES network. So this is the kind of the long list of colleagues working with me in the BIO-FPIES Research Network, and I feel very privileged to have you know, a brilliant team there doing, you know, lots of hard work recruiting all these patients. And I just wanted to highlight my colleague Laura, who's our PhD student doing her PhD with us. Alberto, who's coordinating all the lab work, amazing colleague, and my colleague Bob Boyle, who's you know, senior advisor in this study, and then all the different clinical and lab teams working very hard to make this happen. So thank you very much. And a very special thank you to Joy and Amanda from the FPIES Foundation, who do an incredible amount of work and are a great inspiration and motivation for us to continue to work for the benefits of FPIES patients and their families. And I thank you as well to Dr. Kian Yuan from Boston, part of the medical advisory team in the FPIES Foundation, who has done some work with us developing this survey. So thank you very much for your attention and keep up the good work with FPIES. Thank you very much.